Hi. Uh, I would love to thanks Vicky and Faye for the welcoming week that I've been here. Also to the school and HPALS faculty and staff that has been made the week very easy within the challenges, and especially to all the students that are still on a Friday here after the whole week of like training, going to the field, and and bad jokes. So thank you so much for this is my last like week on 3 weeks, going first to Yaoundé, Cameroon, then Johannesburg, and now here. I'm a little bit tired. I didn't have any time to prepare this, so I've been forced volunteer actually to do this. So please, people, have like in 2 weeks of advance somebody presenting, so the next speaker don't have to go through this. I did it last night, this morning, so some of the things might be a little bit off. I hope hopefully everything is on place. If anything is something that is not clear, please feel free to interrupt me. Okay, so I would love to start the presentation with a little bit of like fun facts, like my name. If somebody knows a little bit of Portuguese, is from a Portuguese-speaking country. My family is Portuguese. My mom was born in Angola, but I'm not from any Portuguese-speaking country. And let's see how you're doing geography quiz things. So in my country, skiing is mandatory in the school as part of physical education. So we get 1 week off and we don't go to school, we go to ski. Also, we cannot fill the FNB stadium. We only fill the 89% of the capacity. And we are the only country with cows in the flag. Anybody knows which country is it? Nope. Nope. Well, yeah, you cannot say. People who knows. All right. So I'm from Andorra, which is that tiny dot. If you do zoom, this is still a tiny dot. And if you do a lot of zoom, then you get something like this, which is basically 40 kilometers country. You drive through in 40 minutes. We're 70,000 people. And we are right in the middle of the mountains, hence it's mandatory to ski because it's our actually source of income. So a little bit of my professional background, as Vicky said, she ruined my speech. I'm a geographer and basically a public health scientist. I built my career into the field of infectious disease during my master's, PhD, my first postdoc, and mostly been focusing vector-borne disease, as mostly like mosquito-borne disease. So I've been around mosquitoes pretty much the last 8 years. People loving mosquitoes and looking at mosquitoes, and it's a little bit disturbing. But what I really wanted to, and I was very interested, is to understand the spatial distribution of the disease caused by vector-borne disease. So why some places have more disease than others, and especially what was the social environmental determinants that enables some of these areas to have more disease than others, right? So it was there, especially during my master's, because I did geography in Barcelona, and also my master's was in Barcelona. However, the master's was in tropical medicine. And my first class, it was general tropical medicine class. There was like a former division director from the CDC delivering the keynote speaking, and suddenly he started to point out people and say some symptoms, and we should guess the tropical disease. And I mean, I didn't know how to differentiate a flu to a cold. Not so I was a little bit frightening. Can I admit this person to the room? All right. But then on the next slide, he was talking about epidemiology, and he had that triangle of population, time, and space. And alongside and during the masters, I realized that a lot of the classes were always focusing on the population and on the time, but little on the space. The space was mostly to say, okay, this happens here, but that's it. So I started to do a little bit of research in malaria hotspots in Mozambique with a group of geographers in the Institute of Global Health. That led me to my PhD in global health in Brazil, where I look at the malaria transmission in the Amazon forest. That then took me to Liverpool to look at vector-borne control in several sub-Saharan African countries, right? Love to mention that actually what I like to do the most is capacity building, a little bit what I've been doing here. Like I love to teach about GIS mapping or any kind of geospatial data stuff. So this has been like a key pillar across all my short career. And also been like very thankful to the places that I've been. So in one of my projects that took me to the border between Peru, Colombia, and Brazil in the rainforest in the Amazon. I was very happy to be there. So actually working with mosquitoes is not so bad. Uh, and then currently I'm based on the MRC epidemiology at the University of Cambridge in the UK. I don't know if ever you like been there or you know how it looks like. When people thinks about Cambridge, they think about this. This is King's College Chapel. This is the most iconic building for the university. But actually, the reality that's this. This is where I work. It's gray, it's ugly, and it's not made us to work. It is not like here. You have like an amazing landscape. Your facilities are awesome. You know, so I don't know why I'm there. Right. So to the work. So as Vicky said, I work in, or I be employed on the Global Diet and Activity Research Network, which tries to focus on how physical, policy, social, environment influence diet and physical activity, right? So we work mostly with non-communicable diseases. We are a partnership of 8 cities, right? So in the African continent, we have Lagos in Nigeria, Yaoundé in Cameroon, Kisumu in Kenya, Johannesburg, Cape Town in South Africa. In South America, we have Brazil, we have Belo Horizonte in Brazil, in the Caribbean, Kingston, and on the north, Cambridge, right? So GDER is actually a I think 5 years program at the moment. So this is the 2.0 is the second part. We call it GDER Spaces. So UCT has been collaborated from the beginning when they built the network, and GDER Spaces, which is the project that I work on, was born under the excellent work of the first GDER, but wanted to incorporate the concept or the climatic dimension into uh, into the studies that we're doing. So, and this works onto the idea that rapid urbanization acts in tandem with climate risk, and this tandem influences population diet and eat behaviors, as well as physical activity practice. This is inequitable and affect mostly those living under precarious urban settings, which poses them into higher risk of climate change disruption, right? It's kind of a circle thing. It's kind of a very complex system. To do this, I've been tasked to lead one of the work packages, and that's why I'm here. And I've been in Johannesburg and Yaoundé the last weeks, and why I'm going to Lagos, Nigeria in 2 weeks' time. So we're trying to identify and characterize the exposure to syndemic hazards, those like climate hazards and the risks in the food environment. And for that, we are the first part of the project is going to conduct environmental audits for unhealthy diets and physical activity. And we after are going to analyze this through the lens of neighborhood level deprivation. And we're going to try to apply some spatial statistics, spatial models to try to understand how the distribution of those elements are different from one side to the other or are similar, right? So as a proof that I've been working, these are some pictures took yesterday. Yesterday we went to Langa to test the the audit tools and the data collection tools that we're using. We were here collecting data about sidewalks and presence of like trees or high fences on the buildings. Here we did it also on the premises of the facility just to get like a dry run. And finally, you deserve a snack, right? So we just sit down and have some snacks in Langa. So because I assume that most of you came here because of the geospatial mapping for public available data sources for public health, I'm going, and I didn't have absolutely anything prepared. I'm gonna give 3 of my projects that I've been working. One is gonna be exactly what I've been teaching here. So it's a very short sum up of what we did. Another one is one project in Cote d'Ivoire about a vector control tool. And finally is one in the Southeast Asia that I'm recently collaborating to see exposure to social determinants of health. So I'm going to start for the one that's more recent and that I've been working recently is we wanted to have this create a sampling strategy for our environmental audits, right? We wanted to collect data about the physical activity features that are on your neighborhoods, and we wanted to collect data about the food environment, right? For this, and for creating the sampling strategy, there was a lot of like theoretical discussions, but then when we get into the hands-on, okay, how we do it, and because one of my skills is the use of GIS, geographic information systems, or mapping, I started to think, okay, we need the street network of those areas that we're going to sample, which were pre-selected based on logistics and local knowledge. The only thing that has to be like good size, like not too big, and to have a heterogeneity on high and low deprivation on the neighborhoods, right? So we needed the street network, but we also needed the buildings because we don't have participants. And normally on this kind of projects, they have participants' addresses, and you assess the built environment on their like environment, like their surroundings, all the route they took to go to work or to school. But we don't have, and we don't have money to recruit participants. So we needed also a starting point. We needed a starting point to where we're starting to map, but also we needed an endpoint, like where people walks, right, towards where. So there we use have a conversation. We use also the knowledge of the students and the researchers here to get like some points of interest within different neighborhoods. For example, for yesterday in Langa, right? And then we created those routes. For this, we use two main data sets that are public available. One is OpenStreetMaps. Probably you encountered public OpenStreetMaps so many times in your life because it provides maps or base maps for websites, mobile apps, and other kind of hardware. I don't know if you are familiar, but this is built by the community and it's maintained by the community. And the original plan when I came here was to do a little mapathon today that will be like gathering people, like the people who is here. We get an area on the map and we map. But in the end, we couldn't do it. Maybe for the next time that I got an invitation to come here, we will do like a mapathon. Also, it comes with pizza and beer normally. And then also we use Open Buildings dataset that's owned by Google. So this is the tricky part. It's not tricky because they put it there for everybody to use, but it's a private company, but has this public available dataset, which has building footprints for, at the moment, almost all the African continent, right? So you have a dataset that basically tells you if this is a building, the precision of the algorithm, because it's a machine learning algorithm, it categorizes buildings into probability of being a building, right? And you can just like download it for your free use. So this is a little bit how it looks. Here are the street networks. Obviously, we filter those network and those streets into some kind of categories. We don't want to survey highways or motorways, so obviously we exclude that. We try to exclude those roads within private spaces because you didn't know if you can walk there or not, and you get with a layer of this, right? So this information is right now for us to use. And then the other one in yellow, orangey is the buildings. This is how looks the buildings in Langa. So both is Langa. And these buildings have been just filtering by accuracy. So everything there is at least 70% probable to be a building. And then we've filtered by size. We just excluded very, very, very tiny buildings because sometimes there are just problems with the algorithm when they're looking at the satellite image. It identifies things that they are not buildings, and especially very tiny things. We assume that nobody lives in 1 meter by 1 meter. Might be a bad assumption, but that's how we did it. And then we create the routes, right? So yesterday we went and we did some of these routes. These are 500 meters routes, starting from random households. So we knew that we wanted to sample the 25% of the street network. So we calculate how many starting points and routes we need. Yesterday we just did a subsample. So we decided to do, I think, 14. And we create the routes along the street network in a direction to something that was a point of interest on the community, right? That was basically what the students have been doing and what we did on the field yesterday. And something that I'm quite excited to talk about is, I don't know if any of you have ever worked with GIS or satellite images, or if you plan to do it. This has been a definitely game changer on the industry, on the geospatial field or science on the last 3-4 years, right? So back in the time, there is satellite data from back on the 70s. So you can download that data. Normally it's NASA that has that data, but they have many of this data is public available. You also can use the European Space Agency to download data, and you can buy data from private space companies. Normally in research, one for ethics and two for budget, we don't buy data, not spatial data. We use the public available data. Up to now, the resolution was not very good, but it is what it is with the technology you have at the time. We still did great things, but suddenly with the pass of the time, things have become very precise, have become, and data that was before very expensive and you need to pay for it has become free. The problem today is like how you process data on your laptop, how you process data with your old, machine. Because we're talking a lot of satellite images that they've been taken every 2 days or every day, in some cases every hour. So there is a lot of data that you need to process. So until Google decides to kill this project, which is called Google Earth Engine, they have provided us with something called Google Earth Engine, which is a planetary scale platform for Earth science data and analysis. That's how they call it. It is a planetary scale platform. This is unique. It's not just for Earth science, so we're using it for public health, and you can use it for other many things. But Google Earth Engine combines a multi-petabyte catalog. It's an immense catalog of data, of satellite imagery and geospatial datasets at the planetary scale. And when I say planetary scale, it's like I can run a process and a script, and in seconds or less than a minute, I will have the data for the whole planet. This will take me a year, 10 years ago. Clearly, my PhD, it took me 3 months to collect all the data that I wanted from my study area in the Amazon. Now I can do it in 10 seconds. Right, so it has changed quite a lot. I want to actually show it. Let me see if it works. If it works, okay. All right. So this is how it looks. It doesn't look nice. It looks a little bit of Sorry. I'll have to get out of the
presentation.
Okay. All right. Yes, fine. I'm sharing the screen.
Yeah.
Yes, cool.
You can change
All right.
the screen. Drag.
Drag the press.
It's an extended screen. Which way?
You wanna go? Yes, sorry. Let's do this. See that again. No, so, all right. All right. So, just I think they should the screen. Yeah. Hopefully, people on with their coffee and pajamas can see it too. This is how it looks. Google Earth Engine. It has like a little area where you can code, but in some lines of code, this is the normal like Google Maps interface. In some lines of code, I can just run it if it works. And it's not working. Oh yeah, and just all right. So just so it depends. All right. So it also it uses internet. That's a big thing, right? It has to use internet, but doesn't rely really on the speed, because what it does is like communicates with the service in Google and tells to the whole Google platform to run the analysis for you. So really you can be like in a rural area, as long as you have a script and a little bit of bandwidth, you connect with them and you send what you want to do and then you run it. This is the city of Cape Town. This is 4 months of satellite image combined. And this is here, for example, if it works, yeah. Exposure to green areas. Let me just load. That's a good time for my bell truck while we're waiting. Still the weight is right. Let's see. Okay. So this is green areas on the city in a quantitative way. Is how we oh, sorry, the mic for the people. That's how we in a lot of studies we do an assessment to exposure to green spaces in the city, right? Like it took us less than a minute when if I was doing this 5 years to 6 years ago, it will take me months to collect all this data to run this analysis, and definitely I wouldn't be able to do it in a presentation in front of everybody. Right, so this has been a quite a huge revolution, and all right. Okay. And I'm really excited. So this morning, while I was coming here, I did exactly the same. And this is Langa from yesterday. And I assess how green space exposure in the community was. We can see that Langa doesn't have many green spots, right? The darker the orange, the more urbanized, the stronger the greenness, and more presence of vegetation and healthy vegetation, right? We create some kind of area of influence. Each of these points are one of our households, and we can see on the immediate proximity of the household how the person living there are exposed or not to green space, either visually or actually in an accessible manner, right? Because you can be exposure but not have access, but you can have visually exposure, right? So we're doing this for Southeast Asia. Unfortunately, I didn't have the data to show you or nor the time to do it. So I run it also in Langa. You also can do this on the route. So if these are the routes that you're taking to go to work or to school or to the supermarket, you can see how, for example, is green or how much buildings you have. And there is a lot of other data sets that you can apply. There is one that is amazing that it measures the canopy height around the wall. Like literally around the wall, you have an estimate of the canopy height and a 10 meters resolution, which is insane. Anyway, so let's go to the last of my projects, a little bit different from the first two that I presented here. This was my previous work at the Liverpool School of Tropical Medicine. Wait, I said public health. No, it's Liverpool School of Tropical Medicine. They wish they were public health. Yeah. So we had a very interesting meeting. There was the Bill and Melinda Gates Foundation, and they have tested this little tool here that they call if tool. It's just you have a house, you implement these tubes, right? These tubes has like a net with insecticide. So when the mosquitoes try to get there, because it's a very small concentration of net, they can put like very high insecticide presence. So the mosquitoes, even the resistant ones, die, right? So they did like a little random control trial in Ivory Coast, and it showed to be very effective, and it showed also to benefit the population on the community, even if not all the houses have, as long as around 70 to 80% of the houses have this intervention, it worked. Obviously, it has a lot of backdoors because first you need to have a house like this, right? It has to be covered up, all the holes and everything. But meanwhile, I was there sitting on the table, nothing to do. So they proposed like, can we try to see if this is feasible for the whole country? Because they wanted to assess if it was feasible for the whole country and if it was also economically viable, right? So what we decided to do was like, let's look at some public data. USAID, an agency in the United States, collects a lot of data in different countries of the world. Not sure if you've been working with that anytime, but one of the things they collect is the DHS, which is the Demographic and Health Survey data. In this case, was a little bit old, but normally it's quite like frequent, like let's say every 5 years. And it has a lot of data. And this is how we look all the data points across the country in Ivory Coast. The green ones are rural, the yellow are urban. It's quite widespread, so it was quite good. And one of the questions that they asked is about household conditions. So they ask about roof and wall materials. So we actually map with the kind of materials that they had, the roofs and the walls, to try to see if it was feasible to implement this intervention in other areas, because you needed to have a strong wall, normal like cement wall or brick wall, because you need to drill, and you needed to have some kind of like metal roof, because if you have thatch roof or some other kind of roof, doesn't matter because mosquitoes will get inside anyway, right? So we use a bunch of like public available data sets. Here you have data from the European Space Agency about the degree of urbanity. So you can see how urban is. So this is not so relevant in cities, but it's relevant on the transition between rural and urban, right? There are a lot of places, especially in the outskirts of cities, that are rapidly changing. So we want to also to assess if those areas were suitable, because we knew that in cities, most of the areas have materials and houses that were relevant for the intervention, but not so much on the outskirts. We didn't know. Then on Google Earth Engine, you also can get like these nighttime lights, which is a predictor of urban areas and how like economically are doing, because then it means that you have electricity. The Malaria Atlas project has a very cool data set that's the travel time from any point of the city to the another main city or to a health facility. So they calculate, they estimate how much time, how long it will take you from point A to a health facility or to a city anywhere in the world. And then we calculate the aridity because it was important as a proxy for economical development. Let me see if I can make this work again. Let me go out of my presentation. Okay, so, and we, oh, see if it loads. It was in the center of the country. Look, I can show you. Just we plot everything in a web, like kind of thing app. So here you can see on the dark point. Yeah. So yeah, and the center of the city of the country was a lot. You can. This is the same data sets, but like in a much more cool format. So this Abidjan, this is the population. So we have like population counts and density, the accessibility. Let me see if I remove this thing. All right, so around the country, how long it take you, right? So this is a lot of public available data that maybe I use it for vector-borne disease, but it is relevant for public health, right? And you can plot all of this together. So let me go back to the presentation. Then you do this, or somebody in the stats department help you with the fancy geospatial models because you are unable to do it and you rely so much on them. Like, thank you for the stats. And then you get some kind of predictions, right? And sadly, on the country of Cote d'Ivoire, only those ones that you see there in green actually have a high probability of having roofs and wall materials suitable for the intervention. But then there is more things that you need to account. It's like it's not just if it's the probability of the model, is also you need to assess logistics, right? So we needed to be less. So on the top, you see the model, right? And we want to make sure that the places that we are going to go ground truthing, it will be at least an 80% above of the cutoff of the probability. But then we needed to be less than 3 hours. It wasn't feasible to drive 7 hours to check it, right? But also we needed that to be a high and moderate transmission area. Oops. You create some other models that you can put all together, and those are actually kind of like the final model, right? All these yellow areas, based on our predictions, were places to ground truthing. So most of these kind of geospatial models, they're only valuable if you are going to do geospatial ground truthing, right? So this is a very different exercise of going to Langa to map the built and the food environment. We also have like an idea of doing this on the whole African country, like on the places where we have data. This helps on a high level to draw some cool maps, and people normally like maps. And yes, I think I'm running out of my time is done. So I'm actually very happy to answer any question, or that's my email if you want to email me anything, or you want make me come here and work from Cape Town. I'm really happy. So thank you so much for attending.